Our bodies very easily turn into an inflammatory state, and if there's inflammation, that's going to negatively affect our eggs and our sperms. A few of the common medical conditions that impact fertility are PCOS, endometriosis. A lot of times we'll see people with autoimmune disease, high blood pressure even, pretty much any medical condition. If a person's not optimized, can on some level affect fertility. Our bodies very easily turn into an inflammatory state, and if there's inflammation, that's going to negatively affect our eggs and our sperms and potentially lead to infertility. Everyone's seen a person who's overweight with a child, so we're all wired differently. Somebody's genetics over here might be able to support a woman to be pregnant even if she's obese. However, this other lady has different genetics and she's not able to have children in her obesity state. There are actually 4 types of PCOS. There's the metabolic type, which if you had or have, we would look at your blood sugar levels and your insulin levels and want to normalize that. There's also the inflammatory PCOS, so we would want to look for inflammation in your body and how can we treat that and lower the inflammation. The 3rd type is we call post-pill, basically post-birth control. If a woman has been on birth control, then we want to have that knowledge and we have a protocol to go through to help rebalance hormones at that point. And then the 4th category is other, that other that we just don't know why. However, with all of PCOS, we know how to rebalance the hormones, so that's a big part. And women, if you have PCOS, the reason why you're not getting pregnant most likely is you're not ovulating, or you're not ovulating every month. So there's a hormonal imbalance for sure, and we need to rebalance your hormones. We need to get you ovulating every month. That is the key to pregnancy. Endometriosis. Unfortunately, we don't know what causes endometriosis, and even diagnosing endometriosis is a bit tricky because we don't have a specific test other than surgery. And in our books, that's the last resort. So we find though a lot of it is related to inflammation. And inflammation a lot of times comes from our gut, actually. So when we heal our gut, we can actually decrease inflammation and we can decrease any immune imbalance that is going on in our body as well. Endometriosis, many times our immune system's off balance. So when we can balance that, we can help heal the endometriosis. We also look at hormone levels. A lot of times women have high estrogen levels with endometriosis. So we would definitely look at endometriosis at a patient's estrogen levels and try to normalize them as well. If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.